Exosomes for hair loss. What do they actually do? So, if you've been looking into hair restoration, you've probably heard about exosomes. But what exactly are they and how do they help with hair loss? And who actually can benefit from them? So, let me break it down. Exosomes are tiny extracellular vesicles released by cells. They carry signaling molecules, including protein, growth factors, lipids, messenger RNA, and microRNA. They are not stem cells. They don't turn into hair follicles. What they do is communicate with your existing cells and influence how those cells start to behave. And that matters in hair loss because in many cases, the follicle isn't completely gone. It becomes progressively smaller. It produces thinner hairs. It spends less time in the active growth phase. And over time, that hair becomes weaker and less visible. Exosomes appear to work by targeting several of the biological pathways involved in that process. They can stimulate dermal papilla cells, which are critical in regulating hair growth. They can increase signals involved in blood vessel formulation, such as VEGF. They influence pathways like WNT-beta-catenin, which are important in hair follicle growth and regeneration. They can also reduce inflammatory signaling around the follicle and help support the transition of follicles into the active growth phase again, right? So the goal is not to create a brand new follicle. In fact, it's not going to. The goal is to improve the function of follicles that are still present. And that distinction is very, very important. The patients most likely to benefit are those with moderate hair thinning, male or female pattern hair loss, diffuse thinning, or miniaturized follicles that are still active. Now, they may also be useful as part of a broader treatment plan with PRP, microneedling, medications, or after hair transplantation. Where they are much less likely to help is an area that has been completely bald for years and where the follicle is no longer viable. So, what does the research actually show? Clinical studies so far have shown improvement in hair density and hair thickness after exosome-based treatments. One systemic review evaluating multiple clinical studies found increases in hair density ranging roughly from 10 to 35 hair per square centimeter, depending on the study and treatment protocol. The studies also generally reported improvements in hair thickness and patient satisfaction with no major serious adverse events reported in the published literature reviewed. So this is where we need to be careful. The studies are still happening and are relatively small. Different studies use different exosome sources, different concentrations, different treatment techniques, and different follow-up periods. So the evidence is really, really promising, but we do not yet have one standardized protocol that tells us the perfect dose, the perfect number or treatments, or exactly how often they need to be repeated. That does not mean the treatment doesn't work. It means this is still an evolving area of regenerative medicine. And one thing I think is important to understand here is that hair loss is rarely just about the hair follicle itself. Iron deficiency, thyroid disease, hormonal changes, vitamin deficiencies, insulin resistance, inflammation, genetics, medications, they all contribute. So if you're treating the scalp but ignoring the reason the patient is losing hair, you may be missing a major part of the problem. That's why I prefer to look at hair loss comprehensively. Exosomes can be very useful in terms of regenerative treatment, particularly when there are still viable follicles to work with. But they should be used in the right patient and as part of an overall hair restoration strategy. The bottom line is this: exosomes do not create new follicles. Just need to understand that. They help improve the signaling and the environment around the existing follicles. The early clinical data is very, very encouraging. And for the right patient, they can improve hair density, thickness, overall hair quality. So if you're experiencing hair loss and want to know whether exosome treatment makes sense for you, we can evaluate the type of hair loss you have, look for underlying medical causes, and determine what combination of treatments is most appropriate here.